Screening is the process of looking at healthy women with no symptoms to find the early signs of breast cancer. At this point in time, no one test is available, like the pap smear for cervical cancer. So, women and their doctors must find the right combination of tests that will work to find cancer when it's still curable. It is important that women of all ages, beginning in puberty, become familiar and comfortable with their breast, since 80% of cancers are not found on mammograms. They are found by a woman herself. You don't necessarily need to hunt for lumps once a month with a formal examination, but you should notice changes within your body throughout the month, whether in the shower, as you dress, lie in bed, or look in the mirror. The important thing is to report any changes like lumps, thickening, discharge, hardening, or redness in your breast to your physician. A diagnosis of atypical hyperplasia is a known risk factor and should be monitored closely by a physician examination and mammography. It is recommended that a woman receive a breast exam by her doctor or other medical professional once a year. With trained hands, a doctor will be able to feel a suspicious lump, particularly on the periphery of a breast, before it shows up on a mammogram. Mammograms are x-rays of the breast that take pictures of soft tissues, allowing a radiologist to see anything unusual. Mammograms can pick up small abnormalities and can sometimes pick up precancerous tissue. Mammograms can help determine if there are lumps that should be biopsied. But mammograms are not a perfect test because they can only see the part of the breast that sticks out and not the outer edges. Also, if breasts are dense, a lump may not be seen through the tissue. Ultrasound technology uses high-frequency sound waves sent like radar to the breast. Ultrasounds can't pick out small details like a mammogram, but they can show the characteristics of a lump. Ultrasounds can see if a lump is fluid-filled or a solid. Doctors routinely use mammograms and ultrasounds together. Breast-specific gamma imaging. Gamma imaging technology is one of the newest methods for looking at breast tissue. Green Memorial Hospital is the first hospital in the Miami Valley and only the second hospital in Ohio to offer this screening to patients.
Breast-specific gamma imaging is a new nuclear medicine test specifically designed for the breast. It is in conjunction with a mammogram. Breast health care does start with self-breast examinations and your yearly mammogram. But with the complexity of tissues within the breast, sometimes we have problems with interpretation of that mammogram. And so the breast-specific gamma imaging test has been developed to specifically answer those questions. We start off with a nuclear medicine tracer, which is very similar to what's used in the heart stress tests. That radionuclide goes to all the cells in your body, and because the breast-specific gamma imaging test is a cellular or molecular type test, it looks at the function of the breast. In that, we can look at the differences between a normal cell and a cancer cell. Breast-specific gamma imaging is indicated in women, particularly those that have dense breasts and high family history of breast cancer. Also in the patients with breast implants, because the implants obscure portions of the breast, this also helps with the detection of cancer. Women that have post-radiation or prior biopsies also will benefit from a breast-specific gamma imaging test. Another indication is the women that cannot undergo an MRI test. Either they're claustrophobic or they have metal within them. Those would preclude them from an accurate MRI evaluation. Very common, we have women that come in that feel a breast mass, but their mammogram doesn't show any abnormality. The ultrasound is normal, and that is an excellent indication for BSGI. The BSGI exam is very quick. It's approximately 30 to 45 minutes for the patient to have the exam, and the turnaround time is it could be within that day or 24 hours. Routinely, we have a report out to your referring physician within 1 day.
Almost every type of breast cancer involves surgery. First, there's the initial biopsy and probably a lumpectomy or mastectomy, as well as lymph node surgery. If you find out you have cancer, it's important to work with your doctor and plan out your best course of action depending on the type and stage of your breast cancer.
A woman has basically two choices up front in terms of what type of local therapy to have. It's usually the first decision that she has to make. That decision is whether or not she wants breast conservation, which means a lumpectomy, versus a mastectomy. Historically, a mastectomy was the operation of choice. Now, over the last few decades, there's been a strong trend, an appropriate trend towards conserving the breast and just doing a lumpectomy. I think in this country now, approximately maybe 60% of the operations are lumpectomy and 40% mastectomy still. Typically, a mastectomy is used if the tumor is large or if it's in several areas of the breast, or if the breast is small relative to the tumor and there might not be a good cosmetic result with a lumpectomy. A lumpectomy is a procedure that removes the lump of tumor itself with a surrounding border of normal tissue. And generally in this country, when you get a lumpectomy, most of the time you have to follow that up with radiation in order to make the results equivalent to that of mastectomy in terms of local recurrence. When you compare the two choices, lumpectomy with radiation versus mastectomy, bottom line is survival is equivalent.
Radiation therapy is commonly used after a lumpectomy. A machine sends high-energy X-rays directly to the breast. The radiation destroys cancer cells remaining in the area after surgery. It is painless and lasts only a few minutes. New techniques in breast radiation include mammocyte therapy that is locally intense but shorter in duration. It's performed in conjunction with a surgical procedure. Chemotherapy is the treatment of the breast with anti-cancer medicine, either given directly into a vein or orally with a pill. The medicine travels through the bloodstream to reach and destroy cancer cells anywhere in the body. Drug manufacturers have made great progress in recent years to curb the side effects of these medicines. Because the estrogen hormone plays such a big part in the development of breast cancer, researchers have learned how to block or counter the effects of estrogen. Patients usually qualify for hormone therapy if their cancer has reoccurred and it is estrogen receptive. It is also used when there is no evidence of breast cancer, but there is a chance it may reoccur. Tamoxifen continues to be the most prescribed hormone therapy. Clinical trials are important in treating breast cancer. Many of the treatments used today began as studies a few years ago. In these controlled studies, some patients are given a new treatment and others are given standard therapy. Then their effectiveness is compared. A woman and her doctor will decide if participating in a clinical trial is a good option. Myths have been spread about breast cancer, particularly through the internet. Before you panic after hearing or reading a sensational breast cancer account, please speak with your doctor or other healthcare professional. Let's look at a few myths. Men can't get breast cancer. Men have breasts, so there is a small chance that they can develop breast cancer. Among men, it accounts for less than 1% of all cancers. About 1,500 men develop breast cancer annually, compared to 200,000 women. Underwire bras contribute to breast cancer. No type of bra is better or worse for you in terms of health. Antiperspirants and deodorants can cause breast cancer. This myth suggests that these products stop the body from purging toxins. There is no research confirming that this is true. Women with lumpy breast will develop breast cancer. Having lumpy, dense, or fibrocystic breasts does not increase a woman's chance of developing breast cancer. Thank you for watching Care to Share. It is our hope that this information has helped you understand breast cancer. This is a very complex disease, and we encourage you to talk with your doctor or read more about it through the American Cancer Society or the Susan G. Komen Foundation. Research continues to move forward in the fight to stop breast cancer at its source. Dr. Susan Love, a pioneer and leader in breast cancer research, feels that the day is coming soon when our daughters and nieces will never have to hear the words, "You have breast cancer."